My trunk is kind of messy.
Hey, white coat. That's how we know he's a real doctor.
Don't use it that often anymore, actually. Golf clubs.
Golf club's also a real doctor.
Yeah, exactly. What's up, guys? How's it going? I'm Dr. Pandey, UCSD internal medicine resident. Just started my 3rd year, which is pretty crazy. Time flies. Already in my last year of residency. Here to, take you through a day in the life and show you what it's like to be a resident. So there's 2 different ways that we take care of patients as residents. There's either inpatient or outpatient. Inpatient is taking care of patients that are admitted to the hospital and are staying within the hospital. Outpatient is like in clinic. Whenever you would go to see your doctor normally, you might go to a clinic appointment. That's outpatient.
So what rotation are you on?
Toxicology rotation. It's actually a subspecialty of emergency medicine. It's important to know that when we take care of patients in the hospital, on the inpatient side, like I mentioned, there's 2 different ways that we do that. 1, there's a primary team that puts in all the orders, and 2, there's consult services which can provide specialty recommendations, for example, in cardiology, pulmonology, something like that. So I'm on this toxicology rotation. We look at all different kinds of toxic ingestions by patients. And as you might imagine, that could be super interesting, like different kinds of drugs, all the way from cocaine to things like spice that you might have never heard about. And then also unintentional overdoses of medications that we prescribe.
Okay, so you're an internal medicine resident, but you're doing an emergency medicine specialty rotation. How does that work?
The great thing about medicine is you get a huge variety of what you get to learn, what you get to experience. And honestly, it's almost like having a new job every month or every couple of months, in that you get to experience super different practices of medicine, etc. Most of the time we rotate within our own specialties, either primary medicine services or medical subspecialties, like, for example, cardiology, like I mentioned. But right now I'm on a rotation where I get to be a kind of guest rotator in the emergency medicine program and learn a little bit about toxicology.
Dr. Pandey, I hope your doctor skills are better than your parking skills.
Can't guarantee that.
So what's going on today?
So I'm on a consult rotation where we evaluate patients that are admitted to the hospital and provide recommendations. So we kind of wait to see when we get new consults. In the meantime, we're doing a lot of didactic teaching, so like lectures provided by the fellows and attendings. Yesterday we talked about meth overdose, which is like honestly a huge epidemic in San Diego. We see it all the time. So today we'll be talking about a topic like that.
Are you the Dr. Pandey from the MedicalInsiders.com blog?
Yes, sir. That is me, guilty as charged. I got a fan over here.
Yeah,
this
man, huge fan.
Yeah, I write and oversee all blog content at MedicalInsiders.com. I've always really loved writing, and so this is a great opportunity for me to combine that love for our desire to pass on knowledge to the next generation of doctors. So,
yeah, paying it forward.
Yeah, pay it forward, exactly. So we've got a lot of great stuff there, and hope that it helps you guys. So please check it out. Let us know what we can provide you. Got a consult, got patients to see. Let's go. Just got done with conference, had a few lectures this morning. We went over some really interesting stuff, talked about aspirin overdose, which is a really interesting disorder actually that can be fatal often. So we got called about an adolescent patient who took an overdose of a medication called Wellbutrin or bupropion, which is a medication used to treat depression. And its biggest side effects when taken in large quantities are seizures. So the patient came in with multiple seizures and the primary team asked us to come evaluate and treat the patient. Always look both ways.
Thanks, Doc. How'd it go?
Great. Patient's doing much better. We confirmed that the seizures were from Wellbutrin as expected. They're stabilized now. We got it under control with medications. And talked to the primary team, gave them some recommendations. We're going to follow along and make sure the patient does great. All right, let's head back to Hillcrest and wrap up with the team.
All right, and we are back at UCSD Med Center here in Hillcrest. So Amit, let's recap the day.
Yeah, so started off the morning with some lectures, had some good learning. Went and saw a really interesting patient, gave the team our recommendations, and since it's a pretty unique rotation where it's chill, I get to finish up. We're gonna take advantage of sunny San Diego and we're gonna hit the beach, get some sun rays.
for those of you who don't know, Amit and I, we went to med school together. We both went to UC San Diego.
Yes, sir.
And we were really good friends. We studied a lot together.
Too much sometimes.
Too much. We would just be in the MET, our med school building, and we would just like, after lecture, we would just camp out there and grind. I know why I chose UCSD, but Amit, why don't you tell the viewers, why did you choose UC San Diego of all schools?
I don't know, man. Like, honestly, while I was sitting here, just looking at the it's really hard to say. You know, it's a tough question to answer. As most people know, San Diego's a beautiful place. The beach, the weather. But also, my family's here. I grew up here. Spectacular program. Really good training at UCSD. So it's kind of a no-brainer. It had everything that I needed.
Nice. It's the way I think about it is med school is very high stress, unfortunately.
True.
And there are ways that, you know, people should mitigate stress. But being in a place like San Diego, it can be a very low stress environment.
Right.
And you know, you can just come to the beach, relax, unwind, de-stress.
Right.
A lot of physical activities you can do, hiking, snowboarding, not snowboarding, surfing.
Damn, I didn't know you guys got snow over there.
We got everything in San Diego.
In med school, I think at the end of the day, obviously not everybody can be in somewhere as beautiful as San Diego, but the key is to find somewhere where you feel comfortable and there's outlets outside of school that allow you to enjoy yourself, whether it's exercise, art, food, whatever. The key for med school is to try to end up in somewhere where you feel good about the program, but also about your life outside the program.
Good fit.
Exactly.
All right, Amit, real talk. How often do you actually get to come to the beach?
Depends on the rotation that I'm on. When I'm working in the hospital, less frequently, maybe once every couple of weeks. But when I'm on an outpatient rotation and the hours are better, I try to come pretty frequently. In the summer, maybe 2-3 times a week, if not more.
Nice, man. So what do you want to do next?
So usually on a day like this, I would go work out. And the way I like to do that the most is I play a lot of basketball. I think we should hit the courts.
Let's do it.
All right.
You ain't got nothing on me, Dr. Pandey.
Dude, I've never seen a guy play defense with a camera before. Look at those feet.
Well done.
Not bad defense.
Well done. Yo, we had matching watches. I got it because I got that watch because you recommended that watch to me.
I know, man. It changed both of our lives.
Yeah.
To this day, the Casio, whether regular or calculator, is my most complimented piece of clothing. And I don't know if that's just because of the Casio or because I'm a terrible dresser.